100 unique facts about the human appendix. The appendix is a small organ. It is a narrow, tube-shaped pouch attached to the large intestine. The appendix is located in the lower right abdomen. It is typically 2 to 4 inches long. The average diameter is about 0.2 to 0.3 inches. Once thought to be a useless vestigial organ, the appendix is now believed to have immune and digestive functions. The appendix contains lymphoid tissue, which supports the immune system. It may serve as a safe house for beneficial gut bacteria. Inflammation of the appendix is called appendicitis, a common medical emergency. Appendectomy is the surgical removal of the appendix and is one of the most common surgeries worldwide. Removing the appendix does not cause major health issues. The first recorded appendectomy was performed in 1735 by Claudius Ammiand. Early symptoms of appendicitis often involve pain near the belly button that moves to the lower right abdomen. If untreated, appendicitis can lead to a rupture, causing life-threatening infections like peritonitis. Appendicitis most commonly occurs in people between the ages of 10 and 30. The appendix can be worm-shaped, hook-shaped, or even coiled. Reptiles lack an appendix. The appendix is unique to certain mammals, including humans, apes, and some rodents. Charles Darwin suggested the appendix was a remnant of a larger cecum used by our ancestors to digest cellulose-rich diets. Some scientists now believe the appendix evolved as a specialized immune organ. Herbivorous animals like rabbits have larger appendices that aid in digesting plant material. The appendix size can vary significantly between individuals. Rarely some people are born without an appendix. The appendix's location can differ, complicating appendicitis diagnosis. In many people, the appendix is behind the cecum, making it harder to detect inflammation. The appendix may play a symbiotic role in maintaining gut flora balance after diarrhea or infections. It contains crypts of Lieberkühn, which house stem cells. Blood is supplied to the appendix by the appendicular artery, a branch of the ileocholic artery. The appendix is rich in lymphatic tissue, especially dense lymphoid follicles in younger individuals. Over time, the appendix may shrink or become less functional with age. Though rare, the appendix can develop tumors, including carcinoid tumors. The immune function of the appendix is most active during childhood and early adulthood. To diagnose appendicitis, doctors often use ultrasounds, Connecticut scans, and blood tests. Many appendectomies are now performed using minimally invasive laparoscopic techniques. In some cases, appendicitis can be treated with antibiotics instead of surgery. Before modern medicine, a ruptured appendix often resulted in death. A low-fiber diet may increase the risk of appendicitis. The appendix can also become infected with parasitic worms. Fecaliths, or hardened stool, and foreign objects can block the appendix, leading to inflammation. In people with situs inversus, the appendix is on the left side of the body. Symptoms of appendicitis can mimic other conditions like kidney stones or ovarian cysts. Interestingly, removal of the appendix has been linked to a reduced risk of Crohn's disease. Unlike the liver, the appendix does not regenerate after removal. McBurney's point, located 1/3 of the way between the navel and the hip bone, is a key diagnostic spot for appendicitis. Our closest relatives with an appendix include chimpanzees, gorillas, and some rodents. Some people have 2 appendices, a condition called a duplex appendix. The appendix may help repopulate the gut with healthy bacteria after infections. Ancient Egyptians and Greeks recognized abdominal pain but didn't understand the appendix's role. Appendicitis is the most common non-obstetric surgical emergency during pregnancy. The first minimally invasive appendectomy was performed in 1983. Appendicitis is the most common cause of emergency abdominal surgery in children. The appendix may act as a reservoir for natural gut flora. Appendicitis rates are higher in developed countries than in developing nations. Some people develop adhesions or infections after surgery. The appendix might influence symptoms of irritable bowel syndrome in some cases. Fossil evidence shows that some ancient primates had an appendix-like structure. Lymphatic vessels in the appendix drain into nearby lymph nodes. It plays a larger role in immune development during early childhood. Its role as a bacterial reservoir supports the use of probiotics. Symptoms of appendicitis can vary. Pain, nausea, and fever are common, but some people only have mild discomfort. It is slightly more common in males than females. Appendicitis can be harder to diagnose in older adults due to atypical symptoms. In the 19th century, appendicitis was often mistaken for intestinal blockages. Millions of appendectomies are performed globally each year. The appendix was first described by Italian anatomist Berengario da Carpi in the 16th century. Conditions like appendiceal endometriosis can mimic appendicitis. People without an appendix may have a slightly reduced risk of colon cancer. A ruptured appendix can lead to localized abscess formation. Advanced surgical techniques include robotic-assisted appendectomies. Before surgery, appendicitis was sometimes treated with bloodletting or laxatives. Some studies suggest a possible link between appendix removal and type 2 diabetes risk. Ultrasound is often used to diagnose appendicitis, especially in children and pregnant women. The appendix may indirectly influence gut-brain interactions. Appendicitis can occasionally mimic gynecological conditions like ectopic pregnancy. Perforations can occur in unusual places, leading to widespread infection. The appendix wall consists of mucosa, submucosa, muscle, and serosa layers. Chronic appendicitis is less common but can cause long-term, mild symptoms. It plays a role in producing antibodies during infections, sometimes removed during unrelated abdominal surgeries to prevent future appendicitis. Other parts of the digestive system can compensate for a removed appendix. Removal may alter gut microbiome composition, though effects are usually minor. Appendix pain can sometimes radiate to the back or other areas. Some people are born with an inverted or unusually shaped appendix. Its narrow lumen makes it prone to obstruction. The appendix contains specialized cells involved in hormonal signaling. Appendectomy may reduce the risk of developing ulcerative colitis. Women may experience appendicitis symptoms that resemble gynecological conditions. Its retention in humans suggests it serves an important, though not essential function. A ruptured appendix can lead to widespread infection in the abdominal cavity. Modern imaging techniques have greatly improved appendicitis diagnosis. Early physicians were aware of its existence but unsure of its purpose. The appendix helps establish gut microbiota in infants. Most people recover fully after an appendectomy without long-term complications. Surgical site infections are a potential risk after appendectomy, especially if rupture occurs. The appendix may aid in the production of certain antibodies. In rabbits, the appendix is critical for digesting cellulose. The appendix is present at birth but smaller in proportion to the rest of the body. Its muscular layer helps regulate contents moving through the appendix. Some studies suggest the appendix may produce antioxidants. The appendix is anatomically considered an extension of the cecum. Imaging can identify fecaliths that often block the appendix. In conclusion, despite being small and often removed, the appendix is a fascinating part of human anatomy with evolving scientific understanding.